Hey guys, welcome back to another whiteboard chat, and today we're going to talk about how to prepare for lab work. So all kinds of different lab work, right? I mean, there's hormones and counts for your liver and kidneys and electrolytes and all kinds of different enzymes. So there are a lot of different markers. I just mainly want to go over typical things that you're going to get tested for most often. Tips and tricks in terms of whether you should be fasting or hydration and timing and just some little nuances that are going to be sprinkled in there too. That way, when you do go get tested, you're having the most accurate results, because a lot of the time, if you're not getting these things checked by your doctor, perhaps, then you're paying out of pocket, right? So you want to make sure your results are definitely accurate, so you're not having to constantly retest, and you know that what you're looking at is actually accurate, right? So, first off, made a list here. These are going to be the main things that we'll touch on. So, obviously, first one, fasting. Do you need to be fasted for lab work? And the answer is, I usually just suggest to go in fasted for most things. And that's because a lot of labs will have a combination of markers that are tested for. Some you need to be fasted for and some that you don't. So it's easier just to go in and be fasted. For example, your BUN and creatinine levels and your EGFR, your kidney filtration, not really necessary to be fasted, but you might need to be fasted for your blood glucose, or at least semi-fasted for your lipid profile. Okay, so it's usually easier just to be fasted. Fasting is, you're going to see different markers. A lot of labs will say something like 12 and 14 hours. Some of that's going to depend on what did you eat the night before, what's the person's metabolism like, so on and so forth. Are you going to get a skewed lab if you're 10 hours fasted, as in you ate at 9 p.m. and you had labs at 7 a.m. the next day? No, you'll be all right. You're going to be fine. So I generally recommend at least 8 hours. I mean, most people are sleeping through the night. Hopefully you're getting close to 8 hours, or at least 7 hours, and then you have a little bit of time before you go to bed where you ate, and then you also have a little bit of time in the morning because you have to get up and actually go to do the labs, right? So generally that's enough time. And if you were to get certain things retested, there are instances where I might tell people hormones, for example, they are somewhat cyclical. Testosterone can be a little bit cyclical throughout the day. Certain hormones can be kind of on a circadian pattern. Reference a circadian video that I did. And yes, it might vary a little bit. So if you're getting them tested multiple times, as in you get them tested once and then you want to retest, I would probably suggest testing them at the same or close to the same time. Now things that do not require fasting could be tested in the afternoon. So sometimes, like kidney markers, for example, and I'll talk about hydration, we're seeing skewed kidney filtration because of a hydration issue. Might have them retest in the afternoon after they're able to drink water all day, just to be sure. So again, kind of the ins and outs of fasting for lab work. Okay, now hydration. Yep, you're definitely going to want to be hydrated. I typically tell people at least 24 ounces. If you're watching this and you measure in milliliters, trying to think, I think it's 5, so maybe like 750-ish, something like that. But 32 ounces would be even a little bit better. Get right up, start hydrating, start drinking some water, okay? Now, can you have, I guess I'll just combine these two here because I put morning stems on here. So coffee. Generally, the lab technician is not going to frown upon coffee. Now, I generally tell people not to drink it beforehand, and that's because it may skew blood glucose right beforehand if we're testing cortisol. Now, the catch to that is if you're doing these things all the time, then obviously if you don't drink it, then it might not be an equal or exact representation of what you would normally see. So if you have a habitual activity in the morning that includes a stimulant, as long as you're not like hammering like 400 milligrams of caffeine and some ephedrine and shit like that, then okay. But if it's 1 cup of coffee, I'm probably not going to worry about it too much. Go ahead and do it and add that to your hydration regimen. Okay, so that kind of covers the morning stims. If you're going real heavy on stims, I would suggest not doing it. Don't smoke cigarettes. Don't consume nicotine. If you vape or do anything like that, I probably wouldn't do much of that beforehand if you can avoid it. Yeah, so that's stims. I know a lot of people will get up and go right to their stimulants. It's pretty much a bad habit anyhow, so this is kind of give you the idea there of how to treat your stimulants before your lab work. Now, here are probably some of the more important things. Well, I would say those things are equally as important, but these are some of the things that kind of get confused is female hormones. So we talk about this all the time. We talk about progesterone, right? And estrogen. Well, those two primarily, because in females they are cyclical throughout the month. We know that progesterone goes up and estrogen goes down and vice versa at certain times of the month, okay? So when would you test female hormones? Couple schools of thought here. So on a lot of blood work, when you get it back, it will tell you on there follicular phase, luteal phase. It'll have those listed on there and generally tell you if you're in this phase, then it should be between this, and it's going to have all those on there. Now, I generally like to go with the week 3 of cycle or day 21-ish. That's assuming you have a 28-day cycle. Now, if you don't, just get as close as you can. Day 1 being the first day that you actually bleed, so day 21 being 21 days after that, or approximately 3 weeks after that, give or take. Okay, so that's ideal. Now, if you do not have a menstrual cycle, we'll get to that. So if you have a shorter cycle, so if you have a 25-day cycle, generally count back about 7-ish days, about a week back, or 7 or 8 days back from the end of your cycle. That's where you're at, right? Okay, and so that's going to give you about the same type of environment. If you do not have a menstrual cycle, well, it doesn't matter that much. I mean, essentially, and a lot of people that do not have menstrual cycles, if it's stress-induced, over-exercising, over-dieting, all these things, or some combination of these things, or total allostatic load of just stress, whatever, they have estrogen dominance, so on and so forth. A lot of these people can end up having lab work that looks very similar to menopause, and they will basically feel like that as well. So menopausal women, doesn't much matter. Women with no cycle at all, doesn't really matter all that much. Now, what I will say is you don't necessarily have to menstruate to ovulate. So you may have some feeling of cyclical hormones. You can kind of, like some of the women will have symptoms around the same time every month or in a cycle. They'll have PMS type symptoms, and if that's happening but you're not actually having a menses, then just do it, same thing, just about day 21, right? You can at least, it's probably going to be about your best bet. You're just not exactly menstruating. And this can go for like birth control, because some of these birth controls, especially like some of these real low dose birth controls, can cause this where they will have some cyclical hormones going on, but they don't necessarily menstruate, and it's all very confusing. So you can get close by using those symptoms, and if you track those things, or if you know about when that happens each month, you're going to be able to know when to get your lab work. If you have nothing at all and you're the same all the time and it's flat, then it probably doesn't matter. Your hormones are probably all going to be low at that point anyhow, so it's probably not going to matter a whole lot. Okay, so common skewed markers and follow-ups. Well, common skewed, I kind of mentioned that earlier, like looking at things that are going to be skewed from hydration. That's a big one. Kidney markers, bond creatinine, also filtration, so GFR, also blood counts. You know, your CBC can definitely be off. Red blood cells, hematocrit, hemoglobin, those things can be off. So if that's the case, for example, if I see, I think of a good example. If I see people that have all of those things are all skewed, and I don't think they should be skewed, I'm normally going to have them retest just as a precautionary thing. If they are still all skewed later in the afternoon when they're hydrated, then we have a problem. But I generally will have them retest just to make sure. So those things are commonly skewed: hydrate, retest. Or things that, let's see, what else would be skewed? Well, I mean, generally, you're not going to have to worry about this with hormones, like I said, unless, of course, you're testing your hormones around the wrong time. I did not mention males. Males doesn't much matter. Just go and fast it. Also, with this, following up with markers that are sometimes more accurate. That's not necessarily the theme of this, but I think that's also important to mention. If I'm seeing things skewed repetitively, then we're going to follow up with more extensive testing. For example, lipid profiles are commonly skewed, and maybe the person also has high blood pressure. Well, we might want to look at a lipo profile. We're looking at lipid particle size. Then we might want to have an actual calcium score, CT scan, to look at, you know, plaque in the arteries. So, you know, there are things we want to follow up. Seeing liver enzymes chronically off, we might want to look at the gamma GT as a little bit more accurate marker. So, I mean, there are things that potentially you would want to follow up on. A lot of it will boil down to proper timing, hydration, and fasting. Now, before we get down to here, I already mentioned non-fasted test timing. So before we get down to medications, this is kind of a piggyback off that. So illnesses and injuries, this could warrant follow-up testing. And the reason for that is illnesses can obviously stimulate the immune system. So we might see immune markers skewed, and white blood cells, or a variety in the white blood cells. There's different lymphocytes and different things going on in there, right? If you see the white blood cell, you see all kinds of different cells that go along with that. If any of those types are skewed and there is a sickness present, or there was a sickness present recently, could warrant follow-up testing. Same with injury. For inflammatory markers, I see that too. Anytime you have lab work, maybe right after training, that is an acute injury to muscular tissue, right? So you're seeing things like creatine kinase through the roof, and liver enzymes, and inflammatory markers. Certain inflammatory markers like CRP is a common one. Exercise can actually lower that over time. That doesn't mean acutely it could not be raised. So just keep that stuff in mind when you see something that looks out of whack, that maybe shouldn't be, that doesn't really correlate with other markers in the labs. Something that's out of whack in isolation by itself, you might want to think back, okay, well, do I have an injury? Was I ill recently? Was I very stressed recently, more so than usual? Did I have inflammation for something? Do I have maybe arthritis and my joints were flaring up? Even something like that might cause high inflammation, right? Having a flare up. So, I mean, there's a lot of things that could go into that you want to kind of take that into the, total context and make sure you weed those things out so you're not freaking out when you see your labs. It's always kind of the questions I'm going to ask people when I see labs and I see something that, why is this in isolation by itself just really skewed way off the chart? So ask those questions. Medications. Take your medications as usual generally. Now, there are cases where sometimes on hormone replacements, some of these women's tests especially, will want to potentially take the medication a certain length away from the test. Most of these tests will have directions. It's hard for me to say which exactly because there's going to be a difference in testing. So I put lab work because I did not say blood work. So if you are doing urinalysis like a Dutch test, there's a whole sheet on there that you enter all your medications, and it'll actually tell you which ones you should omit or take at different times or not take within a certain time frame of the test. And that's so it's not skewing the urinary metabolites from the actual test, because it is reading your hormones, right? Same with blood work. Males, if you're on hormone replacement, you're on testosterone replacement, don't take your shot the night before the test. I mean, you can, but you're gonna have really high test levels, right? Take it a few days out, right? So you're having somewhere close to a half-life, and it looks relatively accurate. Females, same thing. If you have hormone replacement that has like a longer half-life, generally females will use a little shorter duration hormone replacements, like creams and things that might might just be taken daily. So that's maybe not as accurate, but try to take those, if that's the case, try to take those things at the same day, or take them maybe like half a day away from your actual lab test, so you're not taking it right before and your levels are jacked up through the roof. Thyroid medications, same deal. Split them up. Generally, just have people take them in the morning as they normally would, unless we're just actually taking the test for looking at the levels for that medication. So, for example, if someone is trying to take a thyroid medication, and this should be something they're doing with their doctor anyhow, but of course that's not how it always happens. But and we want to see if the dosing of the medication is appropriate. They might want to take it about half a day out, so it has maybe a half-life gone if it's a 24-hour medication, and we can get a more accurate reading and not a spike or a valley, right? So yeah, take that into consideration with medications. If there are any further instructions on your labs, make sure you read them. Always read them. There are things that will skew testing, and there are actually other supplements that can potentially skew markers within the tests that you might not even be thinking about, right? So consider those. Remember to fast for a sufficient amount of time. Remember to be hydrated. Ladies, remember to go around week 3 of your cycle, or as close as you can. If you don't have a menses and you don't bleed, then as close as you can based on symptoms. If you have nothing at all, probably doesn't matter. Retesting for markers that are necessary. Keep your stims limited. Non-fasted retesting for anything that does not require fasting. It is perfectly fine to test non-fasted in the afternoon if you need to rehydrate or whatever it might be. Watch out for illnesses and injuries, for things that might skew markers, and take medications appropriately. So that's it. I know we're kind of all over the place, but that's just kind of a brief overview without looking at specific situations. The main things you're going to want to watch for are really going to be fasting, hydration, cycles, and probably medications. I mean, those are really going to be a lot of your main concerns there. And if you are testing for medication dosing, ask your doctor. Ask them when you should take it in accordance with your actual testing. Okay, cool. Talk to you guys next time.